Thyroid function tests is a collective term for blood tests used to check the function of the thyroid. TFTs may be requested if a patient is thought to suffer from hyperthyroidism or hypothyroidism, or to monitor the effectiveness of either thyroid suppression or hormone replacement therapy. It is also requested routinely in conditions linked to thyroid disease, such as atrial fibrillation and anxiety disorder. A TFT panel typically includes thyroid hormones such as thyroid-stimulating hormone and thyroxine, and thyroid depending on local laboratory policy. Thyroid hormones, thyroid-stimulating hormone. Thyroid-stimulating hormone is generally elevated in hyperthyroidism and decreased in hypothyroidism. It is the most sensitive test for thyroid hormone function. TSH is produced in the pituitary gland. The production of TSH is controlled by TRH, which is produced in the hypothalamus. TSH levels may be suppressed by excess free T3 or free T4 in the blood. Total thyroxine is rarely measured, having been largely superseded by free thyroxine tests. Total thyroxine is generally elevated in hyperthyroidism and decreased in hypothyroidism. It is usually slightly elevated in pregnancy secondary to increased levels of thyroid-binding globulin. Total T4 is measured to see the bound and unbound levels of T4. The total T4 is less useful in cases where there could be protein abnormalities. The total T4 is less accurate due to the large amount of T4 that is bound. The total T3 is measured in clinical practice since the T3 has decreased amount that is bound as compared to T4. Reference ranges depend on the method of analysis. Results should always be interpreted using the range from the laboratory that performed the test. Example values are, free thyroxine is generally elevated in hyperthyroidism and decreased in hypothyroidism. Reference ranges depend on the method of analysis. Results should always be interpreted using the range from the laboratory that performed the test. Example values are, total thyroid-thyronine is rarely measured, having been largely superseded by free T3 tests. Total T3 is generally elevated in hyperthyroidism and decreased in hypothyroidism. Reference ranges depend on the method of analysis. Results should always be interpreted using the range from the laboratory that performed the test. Example values are, free thyroid-thyronine is generally elevated in hyperthyroidism and decreased in hypothyroidism. Reference ranges depend on the method of analysis. Results should always be interpreted using the range from the laboratory that performed the test. Example values are, carrier proteins, thyroxine-binding globulin. An increased thyroxine-binding globulin results in an increased total thyroxine and total thyroid-thyronine without an actual increase in hormonal activity of thyroid hormones. Reference ranges, thyroglobulin equals, reference ranges, other binding hormones, transthyretin, albumin, protein binding function, thyroid hormone uptake. Thyroid hormone uptake is a measure of the unbound thyroxine-binding globulins in the blood, that is, the TBG that is unsaturated with thyroid hormone. Unsaturated TBG increases with decreased levels of thyroid hormones. It is not directly related to thyroid-thyronine, despite the name T3 uptake. Reference ranges, other protein binding tests, thyroid hormone binding ratio, thyroxine binding index, mixed parameters, free thyroxine index. The free thyroxine index is obtained by multiplying the total T4 with uptake. FTI is considered to be a more reliable indicator of thyroid status in the presence of abnormalities in plasma protein binding. This test is rarely used now that reliable free thyroxine and free thyroid-thyronine assays are routinely available. FTI is elevated in hyperthyroidism and decreased in hypothyroidism. Structure parameters, for special purposes. For example, in diagnosis of non-thyroidal illness syndrome or central hyperthyroidism, derived structure parameters that describe constant properties of the overall feedback control system, may add useful information. Secretory capacity. Thyroid secretory capacity is the maximum stimulated amount of thyroxine the thyroid can produce in 1 second. GT is elevated in hyperthyroidism and reduced in hypothyroidism. GT is calculated with or dilution factor for T4, clearance exponent for T4 K41, dissociation constant T4 TBG K42, dissociation constant T4 TBPADT, EC50 for TSH, sum activity of peripheral diodinases. The sum activity of peripheral diodinases is reduced in non-thyroidal illness with hypodiodination. GD is obtained with or dilution factor for T3, clearance exponent for T3 KM1, dissociation constant of type 1 diodinase K30, dissociation constant T3 TBG, TSH index. Jostel's TSH index helps to determine thyrotropic function of anterior pituitary on a quantitative level. It is calculated with. Additionally, a standardized form of TSH index may be calculated with. See also, reference ranges for blood tests. Hormones. References. Further reading, American Thyroid Association, Thyroid Function Tests. Posted on June 4, 2012, seen on January 9, 2013. Thyroid Function Panel, Lab Tests Online, External Links, SPINATHY, Open Source Software for Calculating GT and GD.